Palliative care is really an old-fashioned term, I feel, really. It's, people will be talking about palliative care now since the 60s, so about almost 50 years. And it was started because people with, really at the very end of their lives, people weren't doing so well in the current medical model. So this whole idea of palliative care started. But it sort of moved on a bit from there, and it's now more of a supportive care structure. We depend a lot on other groups, like your group, and allied health groups and community groups, and I suppose palliative and supportive care is more like we sort of coordinate care. I always work with other people. I work with nurses, I work with allied health, occupational therapists, physiotherapists, social workers, psychologists, counsellors. We like to talk to people, talk to families, and help in whatever way we can do that. Over here at the Mater, I sit in a CB11 clinic with the family. We have a long consultation, and then either follow up while patients are still having their chemotherapy, and after they have stopped having chemotherapy, no longer coming to the hospital, we would refer our patients to a community palliative care service in Brisbane, and that's usually run through St Vincent's Hospital or Queensland Health have palliative care services of various usage really in Brisbane and the areas. So what we do in palliative care, we see patients. I always ask routine questions. I ask about their symptoms, I ask how people are getting on, I ask about how they're managing at home, I ask about how the carers, if there are any carers involved. We have patients with wonderful carers and spouses and children. We also have a lot of people who really have very limited resources. And depending on the resources or care that they have, we can then refer on to support through domiciliary nursing agencies like Blue Care or Auscare or Silver Chain. What we try and do, Palliative Care, we try and do symptom management and support, but also if you're at home anxious and fearful and worried and some friction, and that makes everything worse. So we'd like to, as part of general management of people, we'd like to relieve or reduce anxiety and fears as much as we can. And we do that by just talking to people and education and having some sort of contact.